Police stormed the building. The people who are at the Orlando Regional Medical Center had to deal with a mass trauma. They had so many victims that they had to care for. They didn't know what they were up against. At UF Health, they have a trauma center. Channel 4's Kamasi Aaron's covering that part of the story. Kamasi, were any of the physicians from UF Health solicited to come down here to Orlando and help?
No, they weren't, but the head of the trauma unit said they even offered to have some of the patients from Orlando come here to Jacksonville to UF Health to be treated. And they just said it's something that it's hard for one hospital to deal with all by themselves, even if they do drills like they do here at UF Health.
I can't imagine. I've never had that many patients at once. Even on a busy night, it's unthinkable.
Dealing with more than 100 patients in the trauma unit is hard for Dr. Andy Kerwin to imagine. He leads the UF Health Trauma Department and says he's never come close to having to treat so many patients like trauma doctors in Orlando had to do Sunday morning.
Personally, me, probably the most I've had at one time has been about 6 or 8 within about 30 minutes, coming all from different scenes, and that really that's overwhelming when you're one surgeon here with the staff that we have trying to handle that.
There is usually only one trauma surgeon at UF Health overnight during the time when the shooting in Orlando happened. There are others on standby if needed, but in the case of mass casualties, Dr. Kerwin says the hospital has a disaster plan in place. It involves physicians, nurses, and administrators, also surrounding hospitals, firemen, and police. The trauma unit practices that plan every year.
The last one we did was an airplane crash, and so there were many victims that had to be transported from the airport to the different hospitals within the region for everyone to kind of practice that type of event.
But what about space? The UF Health Trauma Unit has 5 beds and space for another 5 or 6 in the hallway.
And part of that plan is making space and utilizing other parts of the emergency department, other parts of the recovery room, ensuring we have ICU beds, opening up operating rooms for patients that would need to go to surgery.
Dr. Kerwin says what happened in Orlando is heartbreaking and eye-opening.
I really think it forces us to think about the plan and make sure that it's up to date and that we have the resources we need.
And Dr. Kerwin told me they were planning to take time to review the plan this month. Now, with what happened in Orlando, even more timely, they will be taking that into account. Also hoping sometime in the future to talk with those trauma surgeons in Orlando to determine what worked and what didn't.